Rick, Tom, thank you for that incredible introduction. You know, several people in the room know this, but just two quick comments about these two individuals that have been so much a part of my life and my success. Rick referred to his recruitment and he and I joining forces many decades ago now. Rick Jacobs was the first person I hired in my role. And the person who, as I said to him many times over, he doesn't go before I go. And the reality is the strategies and all the things that we've developed would not have happened without the vision and execution of that strategy that Rick Jacobs brought to Cedars-Sinai. And if you're going to embark on one of the most important strategic initiatives an organization can undertake, you want to make sure that the person you're looking at to provide the leadership for that is the kind of individual who can make impossible things happen. And that was Tom Gordon. Rick, Tom, thank you both for those kind remarks. You know, in moments like this, award recipients are advised to be brief, be brilliant, and be gone. I'll do my best to at least do 2 out of 3. But let me begin with a couple of thank yous. June, my thanks to you and your team and the Partners of Care Board of Directors for granting me this distinct honor. I've had the pleasure to watch Partners in Care champion higher quality, more affordable, more accessible, and more equitable health care since 1997. And during those years, the organization's not only significantly grown the number of lives touched by your work, you recognize the connection between social determinants of health and health outcomes long before it was fashionable. And so over that same period of time, it's been impressive to see Partners in Care expand its breadth and depth of programs and services as you have excelled in fulfilling your mission. Receiving a Lifetime Achievement Award from an organization whose values and mission I admire, and one that has excelled at fulfilling its own mission, is especially meaningful. I'm also grateful and honored to join Dr. Bob Ross and the late Dr. Paul Torrens and Dwayne Donner as a recipient of the Lifetime Achievement Award. To join 3 colleagues and friends who so deeply admired and respected by everyone in this room, and each of whom candidly played an important role in my own career, is very special. Costello, where are you, Costello? There he is. Congratulations, my friend. Your inspirational comments earlier today took the room, and no one could have said it better than you. Thank you for bringing that challenge and inspiration to all of us. Your award is so very well deserved, and has been noted already, your vision and leadership in creating ultimate health services stands as a model for the country. Lifetime Achievements Award are an honor to be shared equally, I believe, between the recipient and the individuals who've been part of the recipient's personal and professional life. In my case, the personal and professional aspects of my life have been inextricably linked from the beginning. And you heard a little bit about that a moment ago, and many of you know that my wife Jody is the reason I came to Los Angeles and joined Cedars-Sinai in 1979. But what I want to say tonight is far beyond being the reason I first came to Los Angeles. Literally everything that has occurred since, both professionally and personally, has been possible for one reason and one reason alone. And that's the guidance, wisdom, love, and support that she's provided and still does every day. Simply stated, I wouldn't be here without you, kiddo. As the Cedars-Sinai team has heard me say many times, healthcare is a team sport, and leadership matters. In truth, I'm the luckiest person in the world for many reasons, not the least of which has been the opportunity to spend all but 5 years of my career at Cedars-Sinai. It's truly been an honor and a privilege to serve an organization with a DNA unlike any other that I know. From the board of directors, who are committed to fulfilling the organization's mission to the fullest extent possible, to the executive management team and the physician clinical leaders that I had the privilege to work alongside, each of whom in their own way played a key role in making the organization what it is today, to the physicians and staff who over the years made a difference in the lives of millions of people in one or more ways. I just want to thank them all for motivating me every day to match their passion and dedication to heal the world. This award is really as much theirs as it is mine. Given this unique gathering of colleagues and professionals from organizations across the region, I'll close with the following thoughts. First, my deep thanks to all the colleagues in the room that I've had the pleasure of working with alongside over the years, as we've all strived to serve the people of the region. We collaborated and we competed with a shared goal of making healthcare better for the communities we serve. And we've done so in what most analysts consider the most challenging healthcare environment in the country. Thank you for your friendship and shared passion for our work. Second, this is a moment to reflect on the progress we've made and the challenges that have been overcome. I believe to one degree or another, we all chose to work in healthcare to make a difference in people's lives and contribute to a healthcare system that prioritizes quality, compassion, and innovation. Toward that end, I've witnessed remarkable advancements in medical technology and patient care, all of which has been driven by collaboration and the relentless pursuit of excellence. However, at the same time, we must acknowledge that the journey is really far from over. As we face increasingly challenging landscapes, let's continue to embrace change, foster innovation, prioritize equitable access to care for all, and be as committed to collaboration as we are to competition. Working in healthcare is a privilege. Our work's vital, and the responsibility lies with each of us to shape the future. Together, we can address disparities, enhance patient outcomes, and create a system that truly more fully serves the needs of our communities. In closing, I just want to thank each and every one of you for being here this evening. Please continue to inspire, to innovate, and to transform lives, knowing that your efforts will pave the way for a healthier, brighter future. Thank you again for this honor.